Right, so let's sort of start by trying to simplify things, because I know amputees vary, and we've got to think about different factors. But the best scenario is somebody that's got good strength, longish amputations. So you can use some like a standard sling. So don't think you've got to have a specialized sling. So long limb amputees, which are knee and below, then standard slings could be suitable. So it's just working out if that's the case. If the residual limb is much shorter, then we need to think about that, because there won't be any weight and the stump then will not sit within the leg paddle. So we also need to think about that. We also need to think about their upper body strength, if they need extra support from the sling, or if they're strong enough to hold their tone and their upper body strength, then we don't need so much support. So it's thinking about all these things plus the type of hoist. So we'll start with the simplest one, and like Alice said, we've sent you some information. There's a poster with some popular amputee styles that we know have been successful, but each of them will have a data sheet with further information on. So if we just show you the first one, which is the pocket amputee, if you can bring that up, please, Alice. Then this is an access type sling. You'll see the shape, that one, yes. So this is a toileting type access sling. Applies like a toilet sling. So you're looking at someone with good tone, that's got the ability to sit up, that can tolerate a sling with less support. So you can see the shape of the sling. But in this situation, we've got a stump, so the shortish stump, so it needs a pocket to support the stump. So we put pockets on the actual sling so that the stump doesn't slip backwards. But if we just scroll up, these data sheets will have information on sizing, the USPs, codes, measurements. So they'll have lots of information to help you after the session and for guidance later on. So let's come back to me here, please, Alice. And it's very difficult to demonstrate amputees because of not having an amputee person, but Laura, my colleague, going to help me. In this recreation, we've got a dummy with a through hip amputation and a long leg. Good tone, so think about that type of situation. So we've applied a toilet sling, waist support, fit the toilet sling very firmly, so it's fitted at the waist, it's fitted firm, low, and tightened when it's been hoisted. But just turning it to access for toileting, we've got these pockets, and you can have a single pocket or a double pocket, and they are elasticated and just ease back to allow access for hygiene transfer. Hopefully you can see that. The images on the website may be more helpful, but just so that you can see, it is a standard toilet sling in many respects, but with these pockets on. So as I said, these elasticated pockets. If we don't have the pocket on, let me just hold that pocket back. We can see that this stump would then slip back. So it's to support the stump. So short stumps, so thinking about short stumps, long ones you can get away without, but shortish stumps, we need to ensure that the stump doesn't slip back through the commode aperture. So we would put this on a toilet sling to support them. And it's like a pair of curtains, just easing back. Obviously clothing would have to have been removed first, but certainly you get enough access for a hygiene transfer if required. The difference between this and a standard toilet sling is that the tapes to the leg sections have sliders, so that you can adjust if you need to adjust asymmetrically to counterbalance the loss of the stump and the weight. So you can adjust the tapes on sliders here. to make it more symmetrical there. So that's the difference between this and a standard toilet sling. So as I said, this is the best case scenario. Someone that's got good tone can cope with a sling that has less support. So let me just check, see if there's any questions, Alice. If you do have questions, please add them into the chat. Alice will keep checking on those and tell me as we go, or if I spot them, I will be able to help answer the question as we go. But if there are any questions regarding this one, then please jot it down.
We just had a quick question on the pocket. Is it one size only?
Okay, well, depending on the size of the sling. So sling size we've established according to the body size, and then the pockets are they're a formula that they make depending on the size of the sling. So they tend to be one size. If we have to custom make it, then I think it's quite rare. We can do, if you think that we need to make it tighter, looser, we can do, but they are usually one size depending on the size of the sling. Any other questions? No? Okay.
Questions, Mandy, thank you.
Right, we'll just take this one down. I just want to take this, Laura, can you just lower that down? Mm-hmm. And we'll just take this dummy off so that we can demonstrate the next style. Because if we need to, down a bit more, give more support to the trunk. Okay, take that and put that on for him on the floor. Then a good style is a deluxe shape. So if we are familiar with this shape sling, it's based on a universal deluxe, but the sling has leg paddles. The leg paddles wrap around the femur. So again, we're looking at sort of a longish stump so that the paddle will wrap around the femur. And then we have these little clamps. So these are detachable. You take them out. You can position them higher or lower. And it's literally a little strap that wraps around the residual leg to keep it in place. So again, if you think about if there's no weight to the limb, it might move about within the sling and you want to keep it in place, these little straps will work. I will just put it on Laura so we can see and just show you a little clearer. Thank you. So it's full body sling applied in the chair with the leg paddles that wrap around. And if you're familiar with the universal deluxe shape, it's based on that. Right through. So the leg straps come together, connect through the modesty there, and then we feed the outside tape through. So we're getting a pickup at the outside of the leg, which is often more comfortable. It's pulling up and picking up here. But the little clamp, we've got on that side. So single or bilateral, will just wrap around the leg there. We'll just make it a little bit clearer when we hoist up. But we just attach the tapes going on the middle. So we'll just take up the slack and just check. So we're looking at someone that needs more support in the body and they have fairly longish stumps. So I'd say, you know, knee and below. If they're fairly short, then the little straps here will support. Hopefully you can see that. Will just wrap around that residual leg there. But this will give full body support. Support to the stump here. You can see how long that paddle is towards the knee. So you can think about how long that stump will be and visualize if it's very short, how it would just then slip back down. So this is suitable for longer stumps. It's got a divided leg, so we can do a hygiene transfer if needed. There's enough access here for toileting. So this one is it's based on the Universal Deluxe, a standard shape, but with these leg clamps. So if anyone's got, we call it the Universal Amputee. If anyone has any questions on that, please list them. We can add things to it though. If you think you need a bit more support, head support, a chest strap. You know, if someone's a double amputee, they may be a little bit upright and they may need a bit more support from a chest strap here or a waist strap here. Might need to slightly recline so they're not too upright. Also, we could add a hip pickup if needed to help with weight distribution. So picking up at the hip here will lift the bottom. Sometimes quite useful if there's painful joints by lifting here. You can have this in any fabric. So this is a standard polyester. Standard poly, it can be in a mesh. We can do this shape in leave-in fabrics. So there are options for other fabrics too. The standard slings have a safe working load of 220, which is 35 stone. We can go higher, but generally the standard ones go up to 35. And the washing temperature varies, so you must be mindful of that depending on the fabric. So always check with the label. Sling labels are very important that you check that the label's legible. If I just show you, Silvalea are moving over to woven labels. So they're woven and will not fade as much as a printed one, or they will rarely fade unless they've been exposed to a strong bleaching detergent. So check, always check, because the temperature may vary depending on the fabric. Also on the label will have a safe working load, the codes, any safety instructions and things that are important there, name of the sling. So really always check. If you can't read the label, it should be withdrawn from use. Sizing is also woven and the service label. So all the information on the sling now is woven. So that's the first full body style. There are other ones. I mean, if you're familiar with the Fast Fit Deluxe, which has a paddle leg, the Silver Deluxe, there's different types of deluxe leg, and if you have a chance to look at the website, you'll be able to see the deluxe shape paddle, which have been used for many years for amputees. The other very popular one is the Fast Fit Deluxe. Thank you, Laura. So the Fast Fit Deluxe is similar in principle. No, we'll have that chair, please. But it's quite square. So just to show you this version. So quite square legs. So we know that this has been applied in a hammock type position, which is where the leg sections have been laid on top of each other, like that. And then the longer outer tapes connected through. To feed that longer tape through. That's it. And that effectively closes the aperture up. So if you can sit down within that, and we can visualize, hold that tape for me, it'll pick up in a hammock type, which can be okay, but I'm always sort of wary. If you look on the yellow shoulder, if you have amputees, recent amputees, you need to be careful of squashing the stumps together. And if there's any sensitivity, then we need to be just careful that this will happen with this type of pickup. So it's just going to gently behind your legs. Yeah. So we've just bucketed you. So we're thinking you've got short knee amputations, so bucketed a little bit more, slightly reclined, so you're not too upright. And I certainly would check that whether we need a chest strap or waist support on that. But this way of, often this style is called a hammock sling, the old, very traditional fast fit deluxe shape, quick fit deluxe, can sometimes be called a hammock shaped sling. The aperture's closed up there, but just check whether that's going to close the knees together. It could be that somebody, you know, a lady wears a dress or a skirt, they don't want the divided leg, so this could be an option of use. So that's the fast fit deluxe shape. Are there any questions, Alice?
No, no questions so far.
Okay. So again, think about the fabrics, anything you can add on, head support, the chest strap. So, you know, further additions can make it a little bit more specialised there. So we've seen the toileting sling, so the standard pocket amputee, and the two hammock styles. If we need something more fuller body, because we've got quite high amputations, then we will look at a full sling, and I've got that on a different hoist here. And one of the most popular ones at the moment is the recline shape. So the recline is an all-in-one shape sling. I've got one here with a head support and an aperture for toileting. Laura, if you can just hold that for me. So we'll just try and show you the shape of it. And I apologise if it's a bit dark. We are in a temporary room at the moment, which isn't helping, but we're due to move into a new room next week, which will be much brighter and clearer, and I'll have more room. So this is the recline. It's an all-in-one shape, which would need to be applied on the bed. So the previous slings we've seen have got a divided leg aperture section, so you can apply it in a chair. So this one would need to go on a bed with either rolling or introducing it with between flat sheets. And it has a pommel that comes between the legs, and then the tape, outside tape, feeds through. So that works quite well as a little bit of security between the legs there. And this one, as I said, has got an aperture, so we need to carry out a toileting transfer, then we've got the aperture there and a head support. But I've got it on this hoist here just to show you that it is an all-in-one sling. But if you can visualize, you know, a high through hip amputation is probably the most universal of slings and will meet the majority of amputee situations. You can have a little waist support added, so soft little waist support that will be fed through the back. These tend to come in the Superfine Plus fabric, which is the spacer mesh, which can be left in for longer periods if you need to, subject to your risk assessment there. But it's also a mesh, so the Superfine Plus, because it's a mesh, can be used for bathing. The water will drain through, and also comes with a provision for a hip tape there. So we did talk about the hip pickup before, and it looks like that. Laura, if you can just hold this to the side, this sling, and I should explain the hip tape there. So the hip tape would just lift the hips and help with weight distribution if you need to. They can be detached. It's the only tape that we're really offering that's detachable, if not needed. And it looks like this. It's a slider adjuster buckle there, and it will have a bar or a D-ring at the top, and that's so that you don't lose that loop. Extend that, it's quite hard to get that loop back open, so there's usually a plastic bar or a D-ring. Once you've got your setting, push it out the way, but it feeds through and adjust it so that it picks up simultaneously with the leg, so it lifts up at the same time to help lift the hip. So quite good addition to add to this style particularly, but it will go on certain other styles as well. So the recline, I would say, also with a head support, is probably one of the most popular, certainly is for us, for an amputee situation. If you don't want a full head support, then we've got the neck roll. The neck roll is quite nice as an accessory, just to nestle in the neck, rather than having a full head support that can force the head forward. Can be adjusted so it can sit on the side, someone leans over, and it literally, Laura, if you can hold that side for me, please. It feeds through the shoulder loop. It's got a little slider buckle. You feed it through and back in the other side and adjust it accordingly. So once it's set, it can just be left in place, and then it nestles behind the neck. So quite a nice addition to have for to avoid having the full head support. So that's the in-situ recline. Any questions on this one? Are we okay, Alice?
All good, Mandy.
Okay, so thinking about this shape, so it's an oblong shape, it needs to be applied on the bed. There are other options. We've tried to list them on the website, but we don't specifically say amputees because you can use these slings for other scenarios as well. But if you need a hammock shaped sling, there is another very simple one. This is in a mesh fabric, which has been used for bathing, and that's the Silver Deluxe sling. So very simple. You apply it on the bed, as we've said, and the mesh fabric's usually used for hydro or bathing situations, but it's a mesh. Often people will have this Superfine Plus fabric because it's a bit softer, but certainly if you need something simple, then you've got an option of the standard mesh there. We'll have a soft roll at the bottom as well, and provision for a hip tape. But that's the silver hammock. It's not featured on the website, but you can search for it if you put the code in. So those are the main slings for loop hoists. So if you've got a loop type situation where you need to hook up the loops, then think about the length of stumps, the tone, and whether you need to add anything extra like head support and things like that. So it's just like building it all up as to which would be most suitable. If you have the stud or clip hoist, and we'll just swap this over, I'll pull that round and you can take that one in. So if you've got a stud hoist, which is like this, or wishbone, where we need to provide a sling with clips on, the clips are these clip studs that go onto the hoist that's got a stud there, so it needs a specific type of fixing that locks on. This type of hoist, nice shape, open, away from the face, is popular, but in this situation we have to use specific slings. So if you do have this, then we've got a couple of options within our high easy range. And if you go to the website and go to the clip hoist section, then it will help you to see that. A standard high easy sling, it looks like this. So this is a standard one, but as you can imagine, it's quite a big aperture there for anyone that has got short stumps. So what we've done is we've made the sling longer in the body and filled this gap. So we've filled it up to create this one, which we call an all-in-one. So it literally cups the bottom. So it's almost a bit like the recline, because you probably need to get it on the bed, but it comes right underneath here so that you've got no risk of a stump slipping back. Popular also for general use if someone's got this shape hoist that doesn't want the edge risking any pressure around the aperture there. So again, it can be used for other situations rather than amputees. But this is a really nice shape, very smooth, but it's got the clips on, so specific shape for this hoist. And that's the all-in-one amputee sling. Any questions on the stud or clip hoists?
We don't have a question on those slings, but the previous one, Mandy, we have a question. Can we use these slings for one-sided stroke patients?
Okay, so think about that. So think about the situation if you've got someone that's got a weakness and they have no strength and they need a sling to support their body. So I would say use a full body sling and possibly have a hip tape on. So if you've got someone that maybe slump or has a weakness one side, a hip tape will help to lift that area and help to sort of distribute the weight. So you've got a better position for the transfer. So in that situation, look at the in-situ recline with your additional hip tapes that can be adjusted. So think you could adjust the tapes asymmetrically to help to sort of get them into a better position. So a full body sling, I would say, would be more suitable for that situation, yes. Any more, Alice?
We only have one about safe working loads, but I'm just about to put the link to our fabric page.
Okay. So just going back to this shape, so the all-in-one shape, we do have a quantity of disposable versions of this that are available while stocks last. So if you have a situation, mostly hospitals, of course, and you know what a disposable sling is, patient specific, then we can offer this style for amputee situations. It looks like this. And you can see the shape, actually, Laura, if you can help me. So we talked about the shape that's been filled in with very short little legs here. So this is available, I think they're in boxes of 10, and they are available with the clips or the loops. So they can be, we have got a quantity of those available. If you are interested, you need more information, please just email and we'll get further information over to you. But there is a quantity of those available, discounted at the moment. But that's basically it in a summary. I always say to the teams here that not to panic about an amputee, because you know we just need to ask certain questions and work it out. So you know, you just like a sling, if you're doing an assessment, check the hoist first and that will lead you down to some options. Then the tone, if they've got reasonable tone, then you don't need so much support from the sling. And then the length of the stump, whether it's single or bilateral. So it's just like building up a picture, whether you need to add things on, and then which fabric is suitable. But we have lots of helpful information on the website. Certainly we can help you with e-assessments and help you, and we can recreate and demonstrate things for you via this system. So we are always here to help you. The website's very comprehensive. If it's not on the website and you know the code, try and search, because all the slings we've talked about will be searchable, even if they're not featured on and listed on the website individually, but they are available. So let me just check, see if there's any final questions before we finish. Alice?
I haven't had any more in the chat.
So if you think of anything afterwards, please let us know. But you know, thank you for your time. If you need further literature, please also let us know. We will furnish that with you. But thank you for Alice for sorting out the technical side, and to Laura for helping me. And hope to see you again. So thanks very much, guys.